So it's been 3 weeks since my surgery today, and it's honestly felt like an eternity. It has not felt like 3 weeks. So just an update today on talking and swelling and other things. And then at the end, I also kind of want to just do a trip through the house and show what my kind of TJR setup is now that I'm back home. That helps me find medicine, feel relaxed in my home and the environment. I just kind of have a good setup that's been just mentally healthy for me. So if any doctors are watching this, they don't have to see that, and it'll be at the end. This third week's been a little harder, probably just emotionally, just realizing that this is going to be a longer recovery. And so was my fat graft discectomy. When I had that, I was on a lot of medicine for that year to, try and get that to heal. And it wasn't until 6 months when I started feeling normal from a fat graft discectomy in here. So mentally, I'm ready to try and start working again and wanting to see friends again. But I've had some people visit, my sister-in-law's visited, and it just after a while talking, things started hurting. And then just the medicines, you feel weird on the medicines, so my heart rate got really high and I had to just lay down. And I think the best part, if you're a friend visiting somebody who has one of these surgeries, it's nice to just sit in the same room and me being able to listen to conversation going on around me, but me not having to be expected to actively participate in the conversation. So I feel like I'm getting social connection while being able to rest and interact at the time I need to. So that's something good to maybe tell family members or friends that want to visit you if you're having this surgery. So I've been able to go to doctor's appointments and grocery shopping a few times. I felt the energy, there are good high energy days and there's very low energy days. Today's probably been my best day, and I felt up to doing eye makeup for one of the first times, and going out to see the new Batman movie tonight. So ups and downs. I'd say earlier this week, I just got really sad because I felt low energy. I felt, kind of phantom, I don't know if to call it phantom joint pain, but just the surgical pains. And as your mood gets lower, your pain levels get higher when you're not feeling mentally good. So I think that's why it's smart to try and stay on top of your mental health during this time through breathing exercises, meditation, visualizations, prayer, walks, whatever you need to do. Be kind to yourself, because this is a hard time, and let family members and friends know this is a hard time and how best they can support you. It's also been kind of hard to get outside. I live in Texas, but it's been really cold lately. So one night we went down the street to walk and we had to turn back because my face just started chattering. It was so cold and it hurt so bad for my masseter muscles to just start chattering like that. So my husband took off his jacket and I just put it around my head, and we just kind of carefully ran home. So it's difficult if you live in a cold climate and have this surgery during the cold months. It's not as easy to walk around. And I feel like you get better as you walk around more and talk more and move your face more. So I've been trying to do that, and I think it's been helping. So talking about pain levels for me personally at 3 weeks post-op, I'm happy and I'm really hopeful because my past pain patterns are not presenting themselves right now, and I'm very happy about that. The pains I have now, I think, are surgical related. You can just kind of tell just the bony pain from the prosthesis, and kind kind of my septum hurts a little bit. So one of my past pain patterns that I'm so glad has not come back is this horrible pain that I used to get right here. And I actually realized a couple days ago as I was touching there, I realized it feels really hollow, and I'm like, oh, that feels weird. And then I realized that's where my mandible, the edges of my jaw used to be. That was right here. And that was pressing into these muscles and pushing them, which was constantly aggravating muscular systems here and here and here. And my temporalis muscles would be hurting, and just my bite would be hurting. So it's just amazing to have these lifted off my neck. Now I know that's why I had that terrible pain there. And it's just, the neck muscles are feeling better and better all the time. I'd say my tads are also really uncomfortable. I feel good enough to like kind of move around in my mouth and kind of show the camera what these are. So they're just these metal things here and here. You'll see them. That metal and that metal there. And it's just screwed into the bone. And I have a really uncomfortable one up here, which, by the way, if you have a Le Fort and a genioplasty, you lose your frenum, which is that little piece that connects your lips to your gum. And same here, I didn't know that. It seems to not be a big deal, but I was just kind of like, oh, that's gone, okay. And then I have like another tad here. That one's more painful because you can tell my gums are starting to try and kind of encroach around it, and I have to kind of like open it up to get the rubber band. So you have like these rubber bands that you put around the inside. Put that one right there and then one on the bottom, and then do that here and here too. And again, that just helps your muscle memory. Like I was moved so far forward that these muscles are all stretched, so it helps to learn how to open and close, because you don't know where to place your lower bite. Sometimes you kind of place it in a weird position. And yeah, I think the Le Fort cuts are looking pretty good. Those healed up pretty quickly, and I had special mouthwash I used to, I ran out a few days ago, but I used that to prevent infection with the tads and the Le Fort cut. So use your mouthwash if you're given it. And it looks like I'll get my tads taken out at the 6-week mark. And also my surgeon is thinking about fixing my deviated septum at that point, talking about that. So I don't know yet. We'll have to talk about it. I really trust this surgeon. He's awesome. But we also had discussed an ENT doing the operation, because they do nose surgeries day in and day out, and they could make an incision within my nose, whereas I think my surgeon would have to go back in through my Le Fort cut and open that up, and it just feels easier to me to just do that through the nose instead of reopening another cut and getting more scar tissue. But we've yet to discuss it. But I think the main reason that I'm interested in him fixing it sooner is just for the risk of sinus infections. Like, it's not uncommon for people to get sinus infections after Le Forts, and I just don't want to mess with that. Like, if he could fix it at 6 weeks, whereas with an ENT, with my Le Fort fusing, I might have to wait longer, and just the wait times in Dallas to get in with an ENT and then a surgical date is kind of longer. So it might be worth it just to make sure I don't develop a sinus infection. But sinus stuff, that is the most underrated thing of the Le Fort. I was just not expecting to be congested, and I thought it was because of the deviated septum. But the 2 girls I talked to who had surgeries, just all of us 2 weeks apart, they've been really congested too, like ears popping, ear pressure and pain, just all this pressure right across here, just super pressurized. And it's like, even if I just bend my face back, the pressure hurts. I feel like my face is just gonna break or something, which is not. Everything's really, plated and secured. But that's not uncommon, so don't be surprised if you get a Le Fort. Just be prepared. Take Sudafed, take Afrin, Also, things like this have been really helpful. It's just like this personal humidifier. I feel like it's like a product review now. But it's been helpful, and it's small, and you can kind of just like get it right in your face, but its output isn't a ton, so I'd still get a normal humidifier too. Swelling is better. I keep getting told by people I'm seeing like, oh, your swelling looks so much better today. I don't really notice. I'm able to drink better now. This is getting better. Further on in the day, after I've like swallowed 50 times, it's better. It's harder in the morning. So yeah, my swelling's getting a little better, but you can kind of see most of my swelling is like around here. It's just really puffy. Probably just from the Le Fort, and I know those plates are here and here, so maybe my body's not too happy about that. The Genioplasty is definitely, I'm not going to touch it, the most swollen area. Everything else, like this is, a little puffy. I'm getting more and more feeling back. My palate still, I have feeling in the back again, which is great. Not exactly in the front, but that I got feeling back in the back makes me feel like feeling's gonna come towards the front again. And that's part of the swallowing, I think, is I just don't know where food or pills are in my mouth right now, because I completely just can't feel those upper teeth or the palate. I've been throwing this thing around. So this is an ice roller that I bought on Amazon, and I just needed a smaller one. The other one was too big, and it just feels really good on my sinuses and around my deviated septum, since this side's still numb, just to kind of do that. And I feel like, I'm moving maybe fluid down, kind of. My physical therapist is doing some lymphatic drainage down my neck and around here. That's been feeling really good. And then I kind of just sometimes with the ice roller try and do those same motions, or just whatever feels good. And on the swallowing, I've decided to go and see a myofunctional therapist, one that works with a lot of TJR cases, because I don't want to go to a speech therapist or a feeding specialist, because I don't think they're going to know what to do with me. That's just my fear, and like my experience through the medical system is just totally my whole life being misunderstood for the issues I have and misdiagnosed. So I'd rather go to somebody who knows exactly what surgery I had and has had success helping patients before. So I'm looking forward to working with her and kind of getting my tongue working the way it's supposed to, my swallowing patterns working better, tongue placement, lip placement, speaking. I mean, it's all these things that we take for granted, and we think like, well, just do it. It's just like a swallow. But no, it's so hard once your face is moved around. And I had such forward movements that things were in really different places. So I'm happy to work with her and hopefully progress more. And then I guess the last two things I wanted to mention is my physical therapist told me to get some more feeling back in my chin, just kind of with a cotton ball, just lightly kind of do some facial touches. It's, do what you can, because you're given so many instructions from so many different people. Don't stress about it. Just do what you can and heal. But whenever I think about it, I do that. And my mouth opening is still really limited. I'm trying to, whenever I remember, just to sit and go and just let it kind of just hang. So that will kind of increase my mouth opening, but I'm still just a finger. So I think I really need to start working on those more, because I'm worried when I get my Invisalign back in, they use that iTero camera, and I remember even pre-op when I had like a 38mm opening, it was still hard to get that thing in my mouth, and like we're aiming for 30mm here, and I'm like, I gotta get more to be able to like fit that thing in my mouth. So I'm gonna ask my surgeon next time I see him, like, is it totally the worst thing ever if I don't go back for like orthodontic treatment after this? Because my roots are also really short, and I run the risk of losing teeth, but my bite doesn't totally meet up. I'm hitting on my incisors. I'm hitting hard on the right side and not really the left side. So I know I need work. I just hope that that camera can fit in my mouth. So, you know, if I didn't have the short roots that I have, I would have gone the braces route. I think it's easier for surgeons intraoperatively and also just post-operatively to make movements, because intraoperatively they're wiring you shut to surgical splints that you never see to make the proper adjustments. So, you know, I can imagine it was probably harder working off of TADs than traditional braces. But again, my roots are too short, and I think Invisalign was the right call for me. And just a scar update before I go on a tour. This is a really long video, but kind of how those are doing. I'm putting silicone sheets on them again because the stretching, I think, stretches the scar out. And like I've tried like this gel and stuff, and I haven't been super happy with it because it just wipes off and doesn't really stay on. So I think the silicone sheets do a better job. And I kind of have some of the white on me now, but you kind of see that little scar right there. Leads all the way up to there. And then this side. And I've been really amazed at people after this surgery, how well their scars heal up. So I'm just hoping the same for me. But again, not a huge deal for the quality of life increase I expect to get from this surgery. That's just cosmetic at that point. I do see a cosmetic dermatologist though, and she recommended this epiderm silicone sheets on Amazon. So I'm gonna order those next because I trust her opinion. And now for the house tour. So in the kitchen, I've just kind of, you know, made everything easily accessible. This is like my calcium supplement and my emergency. Vitamin C is really important to recovery, so I'd be sure to get that. And it's been really easy for me to just have powdered stuff. Like I know from lab tests I was low in magnesium before surgery, so I knew that would be important to supplement on. And then like something healthy to just add some vegetables powdered to my diet, and then like just something for all my medicines, just that I can kind of cover up and not be annoyed at the clutter. So that's been good to have. And then just a corner with my, you know, protein powder and collagen powder. And then this is basically like where I sit all day, and I just have books and towels for when I'm trying to eat and drool. And my little medicine bunny. It's good to try and make things fun, I think. Like, it looks stupid, but, you know, I see my little medicine bunny, and I'm like, okay, this isn't so bad, I guess. And just having things nice, like a trash can nearby, tissues, because, I mean, you cry a lot during recovery. Things get rough, and you're congested, so you kind of sniffle. Humidifier. Dog is important. Other dog is important. So that's my 3-week update, and I see my surgeon next week just for a checkup to make sure everything's going good. And I think that was a little too much talking on the video, as this kind of is hurting now, so I'll probably go take some medicine. But thanks for watching, and I'm off to see my movie.